Well, good morning, Queensland. I can update Queenslanders to advise that there is one new case today. This new case is locally acquired on the Gold Coast and is linked with the existing cluster. So that brings this cluster on the Gold Coast to 4 people. The person has been in the community for a number of days infectious, and we understand may have recently travelled from New South Wales. So we're still getting details around that, but this may end up being the source of this cluster. But having said that, there is still a risk on the Gold Coast because there are a number of these positive cases that have been in the community for a number of days. So please, we want anyone on the Gold Coast to come out and get tested if you have any symptoms whatsoever. And we have seen our testing numbers go up. So we're now at 39 active cases. We've had 12,468 tests in the last 24 hours, which is great to see so many people still coming out and getting tested, and 10,443 vaccines. Now we are at 87.37% first doses and 78.67% double dose. So we are very much getting close to that 80% double dose. We have 4,404 people in home quarantine at the moment. The first doses are slowing though. So I say to the almost 15% of eligible Queenslanders out there who are not yet vaccinated for one dose, please come out and get vaccinated. The borders are opening on Monday. Our mandatory vaccination social measures come into effect on the 17th of December, and we want everyone to have a safe Christmas and enjoy time with loved ones. And you can do that by going and getting vaccinated. I can also advise that in relation to the Gold Coast cluster, one of those individuals we advised worked at a private aged care facility. The good news is 89 tests have come back and they've all been negative. So that's wonderful news for the residents and staff at that aged care facility. Now, some people may have noticed, and I should say there's likely to be more exposure sites on the Gold Coast going up as we interview this gentleman. So please keep an eye on our website if you have been at the Gold Coast or you live in the Gold Coast area. We did put the Cairns Airport up as an exposure site. That is because we had a overseas traveller who had travelled through New South Wales, was eligible to come up and fly into Cairns and then to quarantine, but they have since tested positive. So people on that flight and at the airport are being asked to just have a look at the date and times and follow the advice of the public health unit in relation to any testing or any quarantine requirements. Now, I am here today at the Story Bridge Hotel with Minister Farmer and the Police Commissioner and Dr. Aitken because we will be releasing this morning the Public Health Directive for our social measures that spell out clearly what businesses are required to have the mandatory vaccination on the 17th of December for their workers and for their patrons, and also those businesses that can continue to operate and allow unvaccinated people in. Now, as we have announced previously, that those sites are vulnerable settings, aged care, hospitals, prisons, disability services. The staff must be vaccinated and all visitors must be fully vaccinated to enter those sites. And I'm saying visitors, of course, not patients to hospitals. Hospitality venues, hotels, pubs, clubs, taverns, bars, restaurants, cafes, they will all be required to have their staff vaccinated by the 17th of December, and also patrons have to be vaccinated to enter those sites. Indoor entertainment venues, nightclubs, indoor live music venues, karaoke bars, concerts, theatres, cinemas, outdoor entertainment activities such as reef excursions, sports stadiums, theme parks, and of course festivals where they're ticketed event, folk festivals, arts festivals, music festivals, weddings. You can have a wedding and have unvaccinated people attend, but the cap is 20 people at that wedding. Otherwise, if it's vaccinated only, then there is no limit to those attending the weddings. Of course, Queensland government-owned galleries, libraries and museums as well. Now, when it comes to other settings, so essential services, supermarkets, retail stores, public transport, places of worship, funerals, then the normal COVID-safe plans, density restrictions apply, and unvaccinated as well as vaccinated people can attend those. Now, I've been asked, why public transport? Well, this is essential. People need to be able to go to doctor's appointments, they need to be able to travel to work, so it's important that everyone is entitled to access public transport. But I will say, if you are on public transport and it is very crowded, we recommend that you wear a mask or you do try to social distance. Of course, good hygiene as well. Those are measures you can put in place to increase your protection. Now, Minister Farmer has put together a kit for businesses as well, so that everyone can clearly identify what businesses are vaccinated businesses, and to support businesses and workers as we transition. There is another thing that we are going to do to support workers and businesses as well. In April last year, we extended the offence of spitting, coughing or sneezing deliberately on people or threatening to do so. We extended that to retail workers because we know they saw appalling behaviour while they tried to just get on with doing their job and serving the community. Well, because these workers in every one of these businesses that we are mandating the vaccination are doing their job to keep you safe and to ensure people are vaccinated, we want to protect them from this sort of behaviour. So we will be extending this offence to protect all workers in all businesses that are bound by this public health directive. That means if you behave in this way, then you can see an on-the-spot fine of $1,378.50, or if your offence is such that the police choose to take you to court, it could be a $13,785 fine or up to 6 months imprisonment. Of course, there's other offences that are already covered under the criminal code as well. But we believe it's important to send a very clear message that these workers are here to do their job, to serve you, to make sure you enjoy your experience at these wonderful venues, but we have a responsibility to protect them as well. So the 17th of December is going to be a great day for so many people in Queensland who get to go out and enjoy the lifestyle that we love so much. They will be able to go there knowing that they've done the right thing by getting vaccinated and that they're walking into a venue where everyone else is vaccinated as well. It also means that these wonderful venues are going to be able to operate at 100% capacity for the first time in many, many months. We know our music halls will be able to open up to concerts again at 100% capacity. So we know this is going to help business and it's going to help protect our community and keep us safe. I now ask Dr. Aitken to just go through the case that I've mentioned today. We're here from Minister Farmer and the Police Commissioner, and of course it's wonderful to have Bernie Hogan, Chief Executive of the Queensland Hotels Association, joining us here today. The last thing I'll say, Gold Coast, we need those vaccination numbers lifting up. We are dropping behind on the Gold Coast again. The Gold Coast is at 84.7% first dose and 76.2% second dose. Now, Queensland has a population of around 4 million eligible to get the vaccine, but on the Gold Coast, 1 in 6 people who are eligible haven't got vaccinated yet. We need this to improve. The Gold Coast is the border of New South Wales. It's where the virus is going to cross over. We've already got a cluster there. Please, if you live on the Gold Coast, come out and get vaccinated today. Don't wait any longer. We are trying to keep you safe. Thank you. I'll ask Dr. Aitken to now speak.
Thank you, Minister. As you've heard, one new case, and that's linked to the existing Gold Coast cases. That brings the cluster to 4. We think that this case may have travelled interstate and be the potential source, but it's too early to know yet. And we're working with that gentleman. He's being very cooperative and trying to track his movements and work out where he's been. And as we get that history, we'll put more venues on the website for people to check in on. I think the more important part to this is that it reminds us that when we're out and about in the community, and this will happen more and more from the 13th of December, that there may be other people in the community who may be incubating COVID, who may be about to test positive, who may have COVID. So we need to all take precautions. If we're going into crowded places, think about wearing a mask. If you've got symptoms, come forward and get tested. If you haven't been vaccinated, come forward and get vaccinated. As the Minister said, the rates at Gold Coast are lower than we would like, and Gold Coast is an area that, as we know, is adjacent to the New South Wales border and is more likely to have people moving back and forth. It's really important that those people at Gold Coast who haven't been vaccinated yet come forward and get vaccinated. 1 dose is better than none. 2 doses is better than 1. But 1 still provides more protection than not being vaccinated at all. And that's the really important thing we want everyone at Gold Coast particularly to be aware of. We know that if you're not vaccinated, I keep saying it's 16 times more likely to be in hospital, be in ICU or die. 1 dose offers you more protection, 2 dose gives you that almost complete protection. The other part is that we are almost at 80%, but we're still inching towards that. But we've got the arrangements in place so people can start to plan, and that's a really important part. So people can start to get those tests organised 72 hours in advance so they know they can come in and do that safely. But it's a good reminder again that as people start to come in, they'll be going not just into Gold Coast, but other areas in Queensland. So we'd ask all areas in Queensland to follow that same advice. Think about wearing masks if you're going to crowded venues. If you get symptoms, come forward and get tested. And please either get vaccinated yourself or ask your friend or family if they haven't been, hey, maybe it's time to think about getting vaccinated now. What about you? Thank you.
Thank you. Well, 17 December is going to be a great day for these businesses that are covered by the Public Health Directive. Some of these businesses have really borne the brunt of the COVID restrictions, and I want to say thank you to all of them for the responsible way they've protected themselves and their patrons and their community. So those businesses from the 17th of December will be able to operate from at full capacity with all patrons and staff vaccinated as per the Public Health Directive. But we know that this will be a new normal for those businesses and their patrons and their staff, which is why we have put together a package of support measures just to help them get through these early days. The first of those will be very clear signage which will indicate to patrons as they enter the premises whether this is a business that requires people to be fully vaccinated or whether they do not require that. You will see the big green tick, and already over 1 million people have downloaded that app, so they have a big green tick when they go to scan the QR code that we're all so familiar with. So we want people looking out for that signage. Is there a big green tick there? If there is and you're not vaccinated, then you are not to enter those premises. We also know that businesses have really quite a few questions about how they support their staff and their patrons, and there are extensive Q&A responses on the COVID website. We will keep adding to those as businesses ask us further questions or new scenarios arise. One of the biggest questions that comes up is how businesses may deal with aggressive customers, and the Health Minister has made it very clear that the new Public Health Directive will prohibit, people will suffer penalties if they are spitting or coughing or sneezing deliberately on those workers in those businesses. We also want to say to people, we want to give them some training and support on how to de-escalate aggressive patrons. So if you decide to go into a business when you've already seen that there's a green tick at the door and you are not vaccinated, we'll offer training, a very short training course which TAFE has put together on how to de-escalate aggressive behaviour, but also how to deal with a range of other issues that might come up in this new scenario. We put together a similar course when COVID first hit, and over 250,000 people have since completed that course. So we're seeing the same level of take-up for this course as well. We are also going to really up our campaign to ask people to treat those workers in those businesses appropriately. These people are working there, often they're very young people who are working there. It's their job to uphold the Public Health Directive, and we're going to be running a Be Kind campaign which actually says to people, treat everyone properly. If you choose not to be vaccinated, that is your decision. However, it is not your right to abuse the people who are simply trying to do their job. So we encourage all Queenslanders, please be kind to these workers.
Thank you and good morning everyone. From December 17, anyone entering pubs, clubs, restaurants and cinemas and the entire list that was read out by the Minister must be double vaccinated. This is the law. So businesses, as you have heard, will be required to display the new rules to help inform customers. It is up to business operators to actually check that the patrons meet these requirements. And this is very similar to the current check-in apps that is happening across all businesses. It is incredibly important that not only the patrons, but the businesses and the community does the right thing. If businesses are experiencing difficult customers who refuse to comply with these rules, ask them to leave the premises and call the police if need be. I welcome the offence, obviously to protect staff further. Anyone that is spitting, coughing or sneezing or threatens to do so, they can be issued with an infringement notice of $1,378, or if we choose to take that person to court, which the fines are over $13,000 and may even be a term of imprisonment. But can I please ask that we respect staff, that both staff, patrons and businesses do the right thing. We've had an amazing record of compliance and everyone being respectful to each other throughout this process. I welcome the 17th, and we have been doing a lot of compliance checks, and this will be part of our regime into the future as well. To give you an example of that, we've done 4,500 business compliance checks just since August this year, So we'll continue to do that to make sure that we are all doing the right thing. And as usual, we'll take that very educated approach, but blatant disregard of the law will obviously result in infringement notices or further action. Thank you.
Obviously, right across Queensland on December 13 is going to be an interesting day. Finally, we're going to be able to welcome people easily back into the state to all the wonderful hospitality businesses. And that's vitally important. And after many holiday seasons that have been disrupted, this is hopefully we're going to see something that's going to keep the hospitality industry and the tourism industry in good spirits leading through the festive season. December 17 is just another day that we are going to have to manage the health outcomes here in Queensland, and I've got a lot of confidence in both the pubs, clubs, hospitality venues, everything that has been read out previously, that we're well and truly ready for this, and looking forward to being able to welcome people under capacity limits that finally have 100% in front of them. And lastly, I think the staff members who are out there day in, day out doing the very best they can for their venues, we really welcome the fact that they have got a further protection, because they're the people who are only trying to do their job. And as I've said many times before, it's simply not fair that people who make a decision not to be vaccinated then inflict their thoughts upon others. So now finally there is consequences, and we have a little bit more protection for our staff. We're really looking forward to December 17. For the staff? Look, for the staff, I think no matter what we do, there will always be some level of complaint at the front door or the entry point or the bar. However, the hospitality industry have been handling difficult customers for absolutely generations. So realistically, I think this is what they would call gaining experience.
Is it possible for staff at big venues to check every single person's vaccination status?
Look, that's what is part of this regime. I think is really important. We have to have best efforts for us to be able to check as they come through, similar to what they do with checking ID or checking any other requirement for people to be in a licensed venue. So generally you will be able to check most of them, but there is also a requirement upon the individual now, and I think that's vitally important.
Minister, if you come to Queensland and you're day 5, you're holidaying in the Great Barrier Reef and you test positive, what do you do then?
So we've been working through this. The sensible approach is that people are required to get a day 5 test. However, and I've had a few examples today where family members, people have told me their families all coming in on the 20th of December, so day 5 falls on Christmas Day. There'll be some testing capacity available, certainly at public sites. We're checking whether the private sites are going to be open. But where you cannot get a test on that particular day because the testing is not available, then we will make sure that the direction allows for that person to get that test shortly before or shortly after to still meet that requirement. So if they're stuck on an island where there's no testing capacity, the aim would be the moment that they leave the island, or if they're about to go to the island and they're on day 3, to get the test before they go.
Sorry, so if they test positive though to COVID?
If they test positive, then the public health unit will tell them what they need to do too. Just as anyone else who's on an island right now becomes unwell and needs to go get a test.
They could quarantine where they are in a hotel?
That will be up to the public health unit to determine how unwell they are, and but they would absolutely need to isolate, just like anyone now, no matter where you are, whether you're on an island, whether you're at a lovely resort. If you become unwell and you test positive, you will need to follow the advice of the Public Health Directive as to whether you need to go in hospital or isolate elsewhere.
What is the process though going forward if you catch COVID in Queensland? How long do you have to isolate for? And if you're vaccinated, can you do that from home? And I guess for businesses as well, if you've got a case of COVID in the business, do staff have to isolate as well?
Yes.
Can you walk us through that process?
So we're working through that at the moment, taking advice of the Chief Health Officer in relation to how long people will need to quarantine who are fully vaccinated when they are close contacts, and also looking at the definition of close contact. And based on what we now know, and again, it may very well differ between whether you're vaccinated or unvaccinated, who needs to go into quarantine and for how long. So we're working through that at the moment based on the best advice we've got and what the national standards are. When it comes to someone who's positive, however, the clinical guidelines are clear as to there isn't a definitive date. It is how long you're infectious for. So I'm happy to just get Dr. Aiken to talk about positive cases. But as always, it's, while you're infectious, you have to isolate. But Dr. Aiken, I might just bring you to comment on that one.
Sorry, for positive cases, once we get notification of those, we'll follow the same process as we've done throughout this, identify where they are, see how sick they are, see what their arrangements are as whether they're suitable to stay where they are, or we need to retrieve them, move them to somewhere where the accommodation is better suited to isolation, or if they need transport to somewhere to provide definitive clinical care as a hospital. The other part of that, once they recover, and recovery, remember, is determined by the series of national guidelines, so that can be clinical recovery, it can be a series of negative tests, or it can be a combination of those. So we'll work through those as each case arrives.
When can we expect to see those guidelines, given the border opens on Monday, the vaccine day comes in on the 17th, about isolation?
So 2 parts to that. So the clinical guidelines, that's the series of national guidelines that are readily available now, and that's the clearance criteria. For the ongoing ability to move people and retrieve people, they'll be available soon for everyone to have a look at. We're working through those with all the HHSs, primary health networks, whereas part of that we're also expanding our ability to use virtual care and virtual wards. And we've done that successfully in Brisbane, and we've done that successfully in Cairns and other areas in Queensland, and we'll expand that throughout the rest of Queensland as well.
Will that be ready?
No. So as long as you've had your test.
On day 5, you can't be in the days leading up to it. You don't need to be on day 5 where possible.
We've chosen day 5 because A, that's consistent with the current arrangements for hotel quarantine, but we also know from practice that about 80% of people will be test positive by day 5, about 87% by day 7. So we don't gain a lot by putting it out further, but by having it that little bit earlier, we pick up most people early. So if people, as the Minister said, if people can't get access to a test on day 5, we'll include information in the direction that you then get the test either a little bit before or a little bit afterwards, depending on the availability and your access to testing locations.
Do children need to be tested?
So children, if they're symptomatic, will need to be tested. again, we're aiming at this stage for people who are 16 and above.
Are you looking at relaxing the quarantine requirements for close contacts, or redefining close contacts? So if you have a case in business, for instance.
Yeah, but that's part, as the Minister said, part of an ongoing discussion at the moment, but we're certainly looking at both what we need to do to keep the community safe depending on the environment, the level of exposure, and also the safety of that community more broadly, depending on the vaccination rates in the community, but also the vaccination rates of the individuals who are the contacts. So in an ideal circumstance, fully vaccinated individuals are likely to move to 7 days, but we need to work through that in a safe manner rather than jumping the gun at this stage.
You've been clear that masks are likely to come back to some kind of setting. Can you provide sort of detail around what the catalyst might be?
Look, personally, as the borders open up, I would suggest that if people are going into crowded environments where you can't socially distance, the ideal thing and the safe thing would be to wear a mask. As we get community transmission, and it's likely that we will get community transmission, they're the sort of triggers that we'd look at as far as wearing a mask, particularly in indoor spaces and crowded spaces, is going to be recommended.
When you say recommended, though, is that mandated?
It'll depend on the level of community transmission as to whether we need to mandate it. I don't think we will. I think Queenslanders will recognise the risk and start wearing the mask themselves. And we're already getting questions about that for a number of people who are asking, is it okay to wear a mask? And the answer is yes. If you're concerned about going out in public, yes, it's perfectly okay to wear a mask and it's a great idea.
And are the COVID wards ready for this influx of cases?
Yes, we've got a number of COVID wards across designated hospital networks now with a number of wards, a number of hospitals. We're expanding that. We're also working with all our hospitals that they need to be able to, and they will be able to, provide COVID care whichever facility they go to. It's the same as someone in a road traffic accident. They go to the closest hospital, the most appropriate hospital, they receive care there. That might be initial care and then be transferred to somewhere else, but all our facilities will be able to provide care for COVID, either initially, temporarily or definitively for full care.
So even in small towns, for instance?
There will be arrangements in place even in small communities to be able to provide initial care for people with COVID, but recognising, same as multi-trauma, they can't provide definitive care there, they'll transfer those people out. And we see the same happening with COVID.
Is that what you mean by you're expanding capacity?
Expanding the hospital capacity, and it will also depend on the numbers of cases, because we are better off co-locating the number of cases in a smaller number of wards. But as those numbers grow, and hopefully they don't, we need to have that ability in place to provide care right across Queensland to those who need it.
That positive case, you say he's been cooperative, he may have been to New South Wales?
Look, we're working through that at the moment, but I'd just like to thank him for his cooperation and the details he's been able to provide us with. And as we get those details, we'll put those venues on the website and let people know. But it's early days yet. At this stage, your information he is, but we just need to confirm that, and let's not jump the gun.
Minister, what are the penalties if people don't get this day 5 test?
Look, the penalties are the normal penalties that apply under any public health directive. So, there are consequences to it, but this isn't about using a stick and going in and fining people. This is about people doing the right thing. We know they're going to be out and about. We know they're going to be on holidays, but it is the case, and especially I mentioned yesterday, 46 cases since we hit the 70% double dose of people coming into hotel and home quarantine that have been positive. That over 80% of those have tested positive in the first 7 days. So we know it's really important. There are consequences if we do find that people have intentionally not gone out and got a test.
So is that a fine?
It is a fine.
And what happens if people come into Queensland and spend less than 5 days here and then go back to have to get tested in the state? Or?
No. It's only, we want to know if you're still in Queensland and you're positive, we want to know about it so we can protect you and can protect the community. If they've chosen to leave the state already, then it's no matter to us.
Do you think our testing systems will actually be able to cope with this?
Look, I do, because they're not all going to hit day 5 at the same time, but it is really important. We've had outbreaks before where we've had large numbers, very large numbers, and we look at the Indooroopilly cluster of people coming out and getting tested. And remember, that was just in one area of southeast Queensland. These people will be getting tested all over Queensland because they're going to be travelling all over Queensland. So, we'll be sharing that load across a lot more testing clinics than we actually had before.
South Australia is reviewing some of its settings at the moment with its outbreak
Look, I'm very confident that we've got the policy settings right. There is no absolute rule book on this, because we are leading the world when it comes to opening up your borders and opening up the community and businesses at 80% double dose. There just hasn't been these examples. South Australia is the closest one we can look at, probably the only one we can look at, that are 2 to 3 weeks ahead of us in opening up, and we can see that they've got cases. So, I think we've got the balance right, but we have to do this carefully. That's why we're still saying you can only come into Queensland from a hotspot if you're fully vaccinated and you've had that negative PCR test. Otherwise, you still won't be able to come in unless you go into hotel quarantine.
With the vaccine mandate, obviously there's going to be a lot of issues hit with unruly customers, and we heard from about hotels are experiencing that, but smaller cafes and smaller stores, they're not going to have the staff and personnel to turf people out. Do you understand how difficult it's going to be for them?
Look, I think we need to remind ourselves, and I want to thank all the businesses who have done an incredible job. I was just saying to Dr. Aiken, I said months before, but I think it's been almost 18 months since businesses have been able to operate at 100% capacity. So this is a pretty exciting shift for our community and our economy to finally be able to operate at 100% capacity. So I know businesses welcome that. For small cafes and restaurants, we have to remember they've been doing a tremendous job already making sure people check in, and when we've had the mandatory mask wearing. So they've already been making sure that patrons are complying with public health directives. This is just another step in complying with public health directives. And we're giving them all the support that we can with signage. No, this is very much a responsibility on patrons. When you walk up to that door and you see that sign that says this is a vaccinated business, if you choose to walk past that sign unvaccinated, it is you that are breaching the rules. It is you that is committing an offence, and there are consequences to it. But I have no doubt businesses will work closely with us and with their with their stakeholders and with their peak bodies to support them in this transition.
If you're a business though and you have a COVID case, can you stay open? What's the rule?
So the rules are the same as what's happening now. Generally, if there's a positive case in the business has to close down to do a deep clean. And once the deep clean's occurred, the business can open again. The staffing arrangements will depend on the level of contact. It may be a business where there are multiple parts of the business and the person who has tested positive only works with one other person and doesn't have contact with the other staff. So it may only mean a small number of people who have to quarantine. Or it may be that every person in the business has had contact with a positive case and they all might need to go into quarantine. This has been the case from day one. It's always a case-by-case basis, looking at the level of transmission, the person, how long they've been in the community, how much exposure they've had to other staff. But hopefully, because of the high level of vaccinations and businesses like this, where everyone's going to have to be vaccinated and all patrons are vaccinated, there'll be very limited quarantining has to occur.
But Dr. Aiken mentioned you might move to a 7-day quarantine for one vaccine.
So we're just getting advice on that, and we're working through that over the next few days.
When do you expect to announce?
Look, as I say, we're working through that in the next few days. We need to make sure we're doing this in a safe way. We need to be confident, remembering I've just said about 83% of people are turning up positive in the first 7 days. That means 17% are positive after 7 days. So if we are allowing people to leave quarantine who have been exposed to a positive case after 7 days, there is likely to be people who turn up on day 12 positive and are in the community. So we all need to prepare ourselves for the fact that there will be many, many more cases in Queensland as a consequence of these changes. So we just want to work with the health professionals about the safest way to do this and the best timing.
Commissioner, could we ask you?
Yes.
That'll be the last one now, guys.
Just on the Strait siege overnight, that obviously was a very tense situation. How did that end there?
Look, that was a very difficult situation yesterday afternoon. You would know that we had a siege in Compton Road, Stretton, from about 2 p.m. onwards for several hours. We had our negotiators there, our specialists, our general duties police. Some members of that business could not get out and were in an adjoining room to where the gunman was, in quite a safe environment. we will allege that that person has tried to fire at one of our officers, and as a result, obviously action was taken by the police. That person was taken to hospital in a critical condition and obviously has passed away. There is an internal investigation which will be overviewed by the CCC, but certainly very tense, very, very difficult, and obviously police have to take action in those circumstances.
Did he try and harm any of those 5 people, and was there any children there?
I don't know if there was children there. There was certainly about 5 or 6 adults in an adjoining room that we tried to separate from the gunmen. They are all safe. They have been all checked out by the ambulance at the time. I'm grateful that they're safe. As I indicated, incredibly tense and difficult situation.
Commissioner, a lot of small businesses and cafe owners are very nervous about this December 17 date, particularly if they have unruly customers and they have to call police. And obviously, police have to, like that incident you just talked about, have many priorities as well. Is there any reassurance you can give small business owners about, are you putting on more staff? Are they going to be given priority in those early days? What are the police doing to help out customers, business owners who are going to have to deal with anti-vaxxers and unruly customers?
So we've actually planned for this, knowing that this is coming, and we've looked at scenario testing, of course, whether it will increase our response, and it will. We've seen that from interstate, but we've planned for that. But what happens after a few days, people generally start doing the right thing. I ask that businesses obviously do themselves the right thing, check customers first of all, have that conversation with customers, undertake the training to de-escalate. But if you're concerned, please call the police. We will always respond. And as I've indicated, those additional protections are extraordinarily important. That's a deterrent for patrons who refuse to do the right thing. So every one of you out there, please do the right thing. Do not take it out on staff. Police will be patrolling and conducting compliance checks of businesses anyway. If you're concerned about your safety and you need assistance, just call the police.
When you say you plan to put extra police patrols on those first few days?
So what we do is we'll look at what's happening and when the directive comes into place. So we'll put additional patrols in, additional compliance checks. So that's already been built into our COVID planning over an extended period of time. So this will be a continuation of that. So have confidence that police will come and see you if there are issues. I ask, though, that patrons do the right thing, otherwise there will be action.
Just the Gabon crash on the Gold Coast as well, another stolen car crash with teenagers. The youngest just 12 years old. How concerning is that? Yeah,
extraordinarily disappointing to see something like that. Young children literally in a stolen vehicle at the speeds that they were travelling at on the highway and had a crash. 2 of those, I understand, are in serious condition this morning. There was not a police pursuit in place at that time. So we are just now following up and further investigations to see why, how this occurred, and obviously if any action needs to be taken, it will be.
Okay, thank you.
Thanks, everyone. Sorry, that might be yours. They will look similar.
Do you guys want cutaways or signage and all that?